As with most things in anatomy, structure determines function. So the structure of these joints determines what functions they can have. Well, we're going to look at some general types of movement, and I do suggest you pay attention to this pencil analogy. A gliding motion permits sliding motion in any direction on a flat surface. Angular motion allows movement along two axes in one plane. And there's also a change of angle. Circumduction is well, this is what you do with your arm when you lift it up and move it into a circle. Circumduction. Rotation is movement around the longitudinal axis, such as turning your head left and right. Movement can also be described by the number of axes. Monoaxial around one axis, biaxial, triaxial. So we'll look at the different types of synovial joints and know an example of each type. A plane joint between the clavicle and manubrium. A hinge joint, a common joint, your knee or your elbow. A pivot joint occurs at the, now don't get nervous about terms like atlantoaxial joint. It just means the joint between the atlas and the axis. So the names of these joints tells you where they're located. So at the atlantoaxial joint between the atlas and axis is a pivot joint. A condylar joint, the best way is to think between your metacarpal, which is your hand, and your finger. The metacarpo-phalangeal joints. A saddle joint is the first carpo-metacarpal, so it's the joint between your wrist and your thumb, and a ball and socket, which would be the hip and shoulder joints. What is the classification of a metacarpophalangeal joint? Condylar. In which part of the body can a saddle joint be found? Hand. Which of the following joint types is not found in the axial skeleton? Syndesmosis. What is the classification of the atlantoaxial joint? Pivot. We're going to use specific terms to describe these joint movements. They're fairly easy. Make sure you get up and actually practice them so that you can distinguish one from the other. If you straighten your arm out, that's extension. If you bend your arm, that's flexion. So with the first one, extension, you're increasing the angle of the joint. With flexion, you're decreasing the angle of the joint. Hyperextension is extension past the anatomical position. And you can watch this animation. Flexion and extension. Wrist flexion and extension. Lateral flexion refers to bending the vertebral column to the side. In our foot, we can point our toes downward, that is plantar flexion, and lift our toes upward, and that is dorsiflexion. Dorsiplantar. Dorsi is lifting your toes up. When we move a body part away from the axis, it is called abduction. When When you abduct a person, you take them away. When you bring towards, you're adding to, that is adduction. So if you lift your arm up, that is abduction, and putting your arm back down is adduction. You can also abduct and adduct your fingers, your wrist, circumduction is moving your arm in a circle. Rotation, when referring to the trunk, described as left and right rotation. This occurs at the atlantoaxial joint, that is between the atlas and the axis. But you can see with the arm, you can also have lateral and medial rotation. Medial, lateral. There's a special term for rotation of the forearm. If you are well, let's look at the next one first. If you are a waiter and you're carrying a soup, think about your palm turned up to hold that soup. That is supination. The opposite is moving your palm backwards in anatomical position. That would be pronation. Pronation, supination. Opposition is the movement of the thumb toward the opposite side of the hand that allows us to hold on to objects. Inversion is twisting the sole of the foot inward. Eversion is twisting the sole of the foot outward. Eversion, inversion. Protraction is moving a body part anteriorly in the horizontal plane. You can do that with your chin. Retraction is returning the body part to normal position. Depression is moving a part inferiorly, as in opening your jaw. Elevation would be bringing your jaw back to a closed mouth position. What term is used to refer to bending at the elbow? Flexion of the forearm. Which of the following movements is not permitted at the jaw joint? Eversion. Which of these refers to moving the sole of the foot medially? Inversion. Which of the following movements is unique to the thumb? Opposition.